I want to thank you all for the opportunity to be here today, and thank you for the amazing work that you do to keep our country healthy. Whether it's preventive care and illness or birth, nurses are the ones at our side. You are the ones that we look to for advice, for comfort, for expertise and care. And I mean that, not necessarily the doctors, the nurses. You are also tireless advocates for our country's health and well-being. For your service and for your advocacy, I want to say thank you. And I want to say thank you for the care that you've given to me in my life, to my kids, to my wife, and to my parents. And that has meant always a tremendous amount to me. When SEIU had me do a walk in our shoes day, they asked me, what job do you want to do? And I wanted to follow around, actually a nurse's assistant, because my mom got such incredible care at Jones Harrison, which is a nursing home in Minneapolis, and I just felt that's what I wanted to do. And I worked with a guy, Ulysses Bridges, who'd been doing that work for about 20 years. And I remember I thought I was going to a geriatric nursing home, but it wasn't. It was for people who had MS, and very severe MS. And the first thing we did was lift people. And he had a sling. And it worked great. And I remember him saying, this is great. This saves a lot of backs. It saves a lot of backs. And I was sitting there going like, I don't know how he could do this without this thing.
That's us.
I guess you do. And I was, so that was sort of the root of all this for me. And so I'm just, by the way, glad there's such a good showing from Minnesota here today. Minnesota nurses are in tough negotiations right now, so I'm glad folks were able to make the trip out here. Thank you so much. Betty Sjogren is here today, and she is a nurse from North Branch, Minnesota, who was the inspiration for the introduction of the Nurse and Healthcare Worker Protection Act in the Senate, because she was injured lifting a very heavy patient. Her story is tragic, and it's all too common. She'd been working for just 10 years when back injuries, as I said, from lifting heavy patients, took their toll. She was put under a 40-pound lifting restriction, and instead of purchasing the lifting equipment that Betty needed to continue her nursing career, her employer offered her an administrative position, one that didn't require any nursing education at all. And the reality is that Betty is just one of thousands of nurses who've lost their careers because we don't have strong, safe patient handling standards in place. We have a serious problem on our hands. We've got a nursing shortage, a nursing workforce that's growing older, and a country that unfortunately is growing heavier. This is kind of a recipe for disaster, and we must take action now. You're the ones that we trust to care for our loved ones, to monitor our health, to provide us with the best treatment possible. That's why we trust you, and that's what you're trained to do. That's what your expertise is. And that's why it's simply unacceptable that you're putting your own well-being on the line for patients. Employers have a fundamental obligation to provide a safe work environment for all workers, and our nurses are no exception. This is just common sense. This has a tremendous return on investment. And that's why I am so proud to have introduced S1788, the Nurse and Healthcare Worker Protection Act. Under this bill, OSHA would have to issue a standard on safe patient handling and injury prevention, including the use of lift equipment. 9 states have done this. It works. Under my bill, all healthcare facilities would be required to implement safe patient handling plans and train their workers to use this equipment. A national standard for safe patient handling is just simply the right thing to do and the smart thing to do. It's the right thing for nurses. It's the right thing for patients.